Hi, my name is Michelle Jean-Baptiste and I am a certified physician assistant. So we call ourselves PA. So what does a PA do? We are considered mid-level practitioners, similar to maybe a nurse practitioner. We are trained to treat, counsel, and take care in a medical capacity patients from 0 to 99. PAs can work in any discipline of medicine. They can be in surgery, in the emergency room, in pediatrics, in GI, in all those different specialties. And we are just licensed to treat and take care of you in any way that you need care. So where do we work? I personally work now in Jupiter, Florida, and also in Pahokee, and sometimes in the emergency room in Palms West. I'm born in England, so I have a funny accent, I'm sure you realize. But I grew up in New York, so makes it Australian, I think now. But I went to PA school in Harlem. I went to PA school in Harlem at Harlem Hospital, and it was a great place to go to get training in inner city hospitals. And PAs are trained to model and shadow medical school. So we train in all the different disciplines of medicine. I then got to graduate and work in an inpatient, that means in the hospital setting, and I worked with HIV positive patients, which was very challenging but rewarding. After that, PAs get the luxury of, when we kind of get a little bored, maybe reinventing ourselves. So I went to family medicine and I got to work with adults and teenagers, and then went into the emergency room. I moved to Florida after working in the emergency room, and I met the pediatrician that I currently work with, and we just developed a relationship, and I ended up morphing into peds. So PAs get the luxury of sometimes, based on exposure and the MD that they work with, going from internal medicine to family medicine to emergency room to potentially OB without necessarily additional schooling, but always learning. So what inspired me to become a PA? Obviously, if you are here and looking at this tape, you probably have some medical love, some health career desire. So that was it. I wanted to, yes, connect with a patient. I wanted to make them feel better. You certainly have, hopefully, something that is called empathy, a word for you to look out, but a way to relate to the person across the room from you, and do whatever you can with that training to make them better. So where did I grow up? Yes, as I said, I was born in England. And the PA profession is a master's degree. So that means 4 years of bachelor's undergraduate, and then it's a 2-year, 28-month specialty program that happens after that. And once we graduate, we are then, like a lot of medical professionals, you have to take a test to be licensed and certified, and which you have to do ongoing for every 10 years or so. About my family. I am married. Yes, you can be married and have a medical career, and it works. I have 3 girls. I had twins, which was a little bit stressful, but yes, I was still able to do medical careers. Some of them allow you to do 12-hour shifts, but kind of made life a little bit easier. 3 12-hour shifts was considered full-time, so there were maybe 4 days that I could fit in our family life. So it works, and you can do both, most definitely. What do I like to do? Bike, run with my dog, probably eat chocolate is a hobby and not a good one, but I like it. Anything outdoor, any outdoor activities, but always learning and doing new things. Don't like to do the same thing twice. I met Dr. Duncan and his wife, and they are good friends of mine, and got introduced to the TLeroy Jefferson Medical Society, and it is a great organization that marries medical professionals of color with the goal of mentoring. Mentoring is the big one, but mentoring and educating students like yourself at all different levels of how to be successful and to reach your career goals. and to tell you that, yes, you are no different than us. You have all the same equipment, and you are most definitely able to reach your goals. You just persevere, and we're here to hopefully hold your hand and give you encouragement to do that. It's a great organization. My words of wisdoms to students considering a career in medicine: love what you do. It wasn't hard. Well, no, I'll take that back. It was hard, but I enjoyed it. So if you love what you do, it doesn't feel like a chore. So you love medicine, you love biology, love to read, and there will be bumps in the road, but do not quit.